Hello, I am Dr. S. Mishra. I am a dental surgeon and I welcome you all to our channel. Now, Ask the Doctor. Today in this video, I will explain the differences between signs and symptoms in a simple way for better understanding. So first, let me tell you about symptom. So what is a symptom? A symptom is something which is felt internally. That is, what the patient feels or what an individual feels themselves are the symptoms. And what is a sign? A sign is something that is observed externally. So a sign is totally different from experienced symptoms. A sign of a disorder is something that may be observed by another or by a doctor or detected during a medical examination or procedure. And the symptoms are the things which an individual or a patient themselves experience. So what you experience are the symptoms and what a doctor finds are the signs. Let me give you an example. Suppose you were experiencing chills and shivering, then sweating, then headache, irritability, general weakness, and whenever you are placing your palm or hands over your forehead or over your cheeks, you find the area hot. So there is an increase in temperature. And these things, what you are experiencing, these are all symptoms. We as doctors, we cannot see these things. So these things are felt by the patients or a person, and these things are the symptoms. Now you visit a doctor and now you are telling the doctor about your complaints. So suppose you are telling the doctor, Doctor, I had the symptoms of fever. Like I had the general weakness, then shivering and chills, then sweating, then I felt some temperature over my forehead and cheeks, or I felt some heat over my body. So these are all the symptoms of fever. Now the doctor will look for the signs, like the doctor will measure your temperature with a thermometer, and that temperature which is measurable and recorded and can be detected by the doctor is a sign and not a symptom. While the headache which you are experiencing because of the fever, but the doctor cannot see your headache, that is the symptom which you can experience but other persons cannot see. But what the other persons can see in you or a doctor can detect in you, like swelling or redness or a rash, these things are the signs. Now let me give you another example. Suppose you are having a toothache or a pain in the side of your jaw or in a tooth. Now you go to the dentist and you are complaining them of your symptom that I am experiencing a toothache. Now the dentist examines and first they found out a black dot or a black color thing inside your tooth, and that thing is the sign of caries. So what pain you are experiencing, that is a symptom. Hence toothache is the symptom of caries, and the black destruction over the tooth which the doctor finds is the sign of caries. So few examples of symptoms which an individual feels internally are like dizziness, then numbness, then lightheadedness, then fatigue, then vision disturbances, then ringing in our ears, etc. So these are all examples of symptoms. Now let me give you some example of signs. So the most important signs include our breathing rate, heart rate or pulse, then temperature, then blood pressure. These are all vital signs. Vital signs can also include the other measurements such as pulse oximetry or how much oxygen is in our blood. So these are all signs. Sometimes signs and symptoms overlap, and these are all indications of some diseases. Like these are certain signs of some diseases and these are certain symptoms of some diseases or disorders. That's all. If you find our video informative, then please subscribe to our channel for more health related videos, informations and current health issues. Thank you. Stay healthy and stay safe.